Hi all, and today we are going to discuss one case study that is related to application of ultrasound. Before getting into this topic, we know these days in healthcare sector, the diagnostic imaging tool modalities plays a vital role. Okay, so in order to visualize any organs or to identify the disease, or to identify the progress and or the status of disease and so on. So we have a different imaging modality, X-ray, MRI, CT, and ultrasound, and so on. But when you take these X-ray, CT, MRI, the radiation exposure will be more compared to the ultrasound. So that is the reason the ultrasound is plays vital role compared to other imaging modalities. Yes. So in this case study, we are going to cover what how this ultrasound imaging modality has been evolved right from beginning to till the date. So if you take in the beginning 20th century, there is only one medical diagnostic imaging tool is with us, that is the X-ray. We know what is meant by X-ray, right? So this is the X-ray is one of the imaging modality which is meant to focus or image the heart tissue by with the help of X-ray radiation. So if you see the shortcoming, that is a disadvantage of this X-ray is the patient discomfort, because the patient need to stand for over a period of time till the course of a diagnostic process is completed. So this is going to be a discomfort for the patient during the treatment. And if you take the second disadvantage is the intense radiation exposure. So here we are using the X-rays as a radiation. So we need a dosage, we need a high dosage to have such treatment in order to, such diagnostic process in order to obtain a useful image. Because of the reason, it is not recommended to the pregnant women and the infants. So because of these drawbacks, the researchers and scientists really need one such innovation to overcome these drawbacks. To mainly there needs some modality for pregnant women and infants. As it is because of this, in 1943, the NHMRC, that is National Health Medical Research Council, established acoustic testing laboratory. They started to working on sound acoustic test laboratory at in Sydney to undertake the wartime research, and then later this laboratory become Commonwealth Acoustic Laboratories, that is called in 1947. That is at the time of the India got independence, right? So in 1975, slowly the ultrasonic research section become Ultrasonic Institute, that is UA, which is being directed by the scientist Norman Murray. This particular scientist mainly they are focused on deaf veterans and the children's which is being affected during that epidemic of metral rubella in 1940 to 1941. And then slowly they will been they have been started to develop this application to some more disease like Maynard disease, Parkinson's disease, and so on. And then later they started to diagnostic the breast tumor also. And then these the ultrasonic institute team start to continue to have more improvements in their scans, and then they have been started to work on diagnostic some other organs, that is a brain, heart, and so on, right? So and also in 1975, the Kossoff and Robinson is the scientists, they developed the UT team into UI team into UA octosen. Then UA octosen was transferred into transferred into CSIRO in 1989. It's become one of the ultrasonic laboratory and still until 1997. Yes, so this is overall what the timeline for the history of how the medical ultrasound is being evolved. So it's been started from 1940 to 97. Here I have been listed. So ATAL established, and slowly then it can change. It been developed into call established, and ultrasonic section is established, and then slowly the innovation is started to have in the area of abstractives and breast and heart, a fetal heart here, and heart and fetal heart and brain, and then slowly the innovation is start to evolve, right? So this is the timeline of medical ultrasound. So yes, the scientist is being keen on ultrasound application during those years. So they need some fund, right, to have their research without any like a distraction. They have to complete their research. They need support, that is called fund, right? So for that, they have been during the year, that is 1979 72 1970, the NHMRC funded these researchers in call and UI researchers. One such fund, these are the following professors they offer the fund, included Professor John M. Caffrey for to have a study on blood flow, and then Professor David Whitland. This studies is about to generate the images of the heart, that is a multi-scanning electrocardiography, and the Professor Brian Trudinger, they work on Doppler ultrasound to have a blood flow volume and velocity studies of, especially they work on placenta and fetus, that is the mother and fetus. And Professor Thomas Drevey, they work on catheterization of breast tissue with the help of ultrasound. So these are the work the NHMRS funded researchers. So if you see the health outcomes and impact of this ultrasound in late 1960s and 1970s, they mostly focused on cardiac diagnostics with help of this ultrasound. Then they have shown a very good improval, that is improved survival rate because of this ultrasound results. They have turned many chronic heart disease patient into normal patients. They have been identified at a right time. So that if you have a right time identification for particular disease, that the survival rate for particular person will be high, right? The percentage of survival rate will be high. So if you are giving a right treatment, right diagnosis at right time, and giving medicine at right time, that is the success of the treatment will be high. So that is in 1960 and 1970, the cardiac diagnostic with help of ultrasound have shown very good promising results. And in by the mid 1990s, slowly their application is focused on cardiac and vascular ultrasound. Okay, they to have what is the blood volume and the blood, not only cardiac heart, and and then blood vessels also, they have been started to focus to identify any blood clots or some problems present in the blood. And then in 1995, this ultrasound now it's purely there is going to work on pregnancy people, so to identify different routine checkup like trimesters, to have a like baby growth, to can visualize in order to avoid neonatal mortality. So in 1995, the ultrasounds have very good peak and impact on pregnancy people, shows the result of 97 percentage. So as I said before, the routine testing to 18 week scan in pregnancy also reduced prenatal mortality, that is with the help of ultrasound. So then even next Doppler ultrasound is also being used to identify the umbilical artery, to again to find any problems, high risks in pregnancy. So this is also going to be pave the way to reduce the odd maternal death by 38 percentage. Slowly, as I said, the UI was transferred into CSRO 1980 and becoming into Transonics laboratory until in 1997. We discussed in timeline. And this Australian in 92, Australia Post issued a stamp highlighting ultrasound as a part of Australian innovation series. So this is how the medical ultrasound is slowly reaches their peak, and now it's being widely used in all over the hospitals, and reached all the markets, and it gained trust also, because the trust is very important. What are the results is coming out the device or the equipment or machine, the doctors is believing it, based on that only doctors is prescribing medicine or the treatment. So the medical ultrasound is one of the such promising device these days, is highly used to have many identify the many problems at a early stage. Yes, thank you.